Palmieri Hospital has just done an enormous service for this city. We continue to grow. You've got to take great care of children. We do a fantastic job. People look to us for answers when there are none. People look to us to solve problems that are difficult, and I feel very proud of that.
I attribute our success to the fact that we've been able to, over the years, attract great people to work here. Doctors, nurses, child life workers, support staff. We have a committed group of people who really are looking out for kids, really care about children and families, and want to do the best for them.
We discovered that Anna had epilepsy when she was 5 months old, and it was very shocking and disorienting. The might of the seizure that would overtake her, they were dangerous to her.
She would have 6, 7, 8 seizures a night. We had to have her by our side all the time. And my youngest would have to sleep by herself. The seizures were so violent, I couldn't even hold my own daughter anymore.
Over the years, we saw many different doctors, many different facilities. We tried many different medications and approaches to the treatment for her nocturnal seizures. When things changed last spring and the seizures became evident all day, it was an emergency.
I was at softball practice. I thought that I was going to do great in my game, but all of a sudden I couldn't feel my legs. Everything just went numb. Then we went to the emergency room.
I first heard of Anna's case. I was the pediatric epilepsy doctor on call for the hospital. The story was pretty convincing that she probably had frontal lobe epilepsy, and that she'd been having this since she was an infant. And the thing about frontal lobe epilepsy is that if you can find the lesion, you can take it out and it can be curative.
Dr. Greenspan called me, having been the first to assess Anna in the ER. She was almost in what we would call status epilepticus, meaning that there is essentially no time between seizures. So once a patient gets to that stage, such as Anna was moving towards as she hit our doorstep, things ramp into high gear pretty quickly.
We were so exhausted and we were so frightened, but everyone put us at ease. They took such good care of all of us as a family, and they were so confident.
You collect many data points through a battery of tests and line them all up and layer them together, and where the overlap of all those layers of tests occurs is your potential surgical target.
Surgery is a big deal. I mean, to operate on a child's brain, like no one's going to do that lightly. We have a team approach to particularly complex epilepsy cases like Anna's, where there's multiple different people all in the same room together, all discussing the complexities of care and the complexities of the case.
And listening to Dr. Greenspan talk about his department and the team and how they worked, we felt that the unimaginable, which was brain surgery, was the right choice.
The collaboration that I have with Dr. Hoffman taking care of these pediatric epilepsy patients has been incredibly productive and very meaningful to me. Epilepsy expertise and pediatric expertise, and the combination of the two makes such an impact on a child's life.
No one can predict the future, but we felt that we had the best team that we could possibly have at this point, and we needed it.
The surgery was successful. I mean, she's now seizure-free. Whole life is now changed for the better. I mean, what's better than that?
For people out there who think that there's no cure, I just want to say you should always just stay positive and stay hopeful. There can always be a cure, because that's what happened to me.
Not until a couple of office visits after did we see the full Anna in full true color. To be able to play any role in the gift of giving that back to a family and to a patient, it's pretty wonderful.
NewYork-Presbyterian Palmieri Hospital has given us the gift of a normal life.
I really believe, I feel like we have nothing to worry about anymore. She's been given a new chance at life.
I don't have any more seizures. I don't have to sleep with you guys anymore. I just feel like I can finally be myself and see this other side of me that I never saw before.